this is recording or not. So I think I can edit this in. Oh, it is recording. Okay. All this instruction to create a private listed. Stop because Let's do that. Oh. Take this over here. Hi.
Hi.
Can you hear me?
I can hear you.
Whoop.
Can you hear me?
I can't hear you.
Uh-oh.
Wait a minute.
Let's see.
My audio on? No.
I
don't know why I can't.
You can't hear me?
Can you hear me?
I can hear you. Mm-hmm.
I can't hear you.
Let's see if I can fix. Maybe your sound is off, Mom. Hold on. Give
Oh,
me
I
just-
can hear you now.
Can you-
Yeah, now I can. I don't know what the deal is.
Okay, we're good. Okay. Yeah, I know. I was trying to use the same number from the last time, and it kept giving me an error message. So I was like, "What the heck?"
Well, last time when we were finished, I got confused and I thought I uploaded the video to her, but then I saw it said, no, upload it to a YouTube channel and then give her that link. So when I went back, I couldn't go back into it.
Oh no!
So I think I lost it. I'm so sorry.
So what should we do? Have you talked to her at all?
No, I'm gonna send her an email.
Okay.
I'm still trying to mess with it.
If not, we can just maybe re-record it. That's what I was thinking.
Well, and they said for this one to talk about the journal assignment and then redo it. So I'm hoping. I'm so sorry.
No, don't be sorry. I feel just as frustrated with all of this stuff. It's very, I find it very not so user friendly. There's just a lot of little things.
Yeah, this is where I feel old.
Same. Yes, me too. Yes, I'm still used to going to college with, DOS.
I am used to going to college with a notebook and a pencil and going to the library with the what was it, the cards, remember?
Oh yes, it's microfiche.
No, even before that, the card catalog. You don't remember that because you're a youngster.
Nope, I still remember. You're looking through the indexes. Yep. I remember having little shows that were in like almost like a microfiche, but it reeled into like a little mini machine, played almost like a real movie, but it was like on almost the size of a film. Like, old school camera film, and you fed it into the machine. And I remember watching Morris the Moose. Yeah, that's some old stuff, right?
Well, we will get it this week.
I hope so, because I feel very overwhelmed when I'm behind, and I feel very overwhelmed. I still haven't got my books. My books have been delayed twice. So
oh my goodness.
I'm very stressed out about that. Just seems to be, I need it to be,
Well,
but
we'll
do what we can.
I've done the reading, and I think that she does a great job on the PowerPoints of summarizing. So I think you're okay with the summaries for a while if you just go through the PowerPoints.
Okay. Well, and it just seems to be a lot. Like even when you click into, there's just strange. Like it's just overwhelming. I'm just used to like 1, 2, 3, 4, 5,
Right. So, I think, I don't know about you, but it makes me doubt myself so much. And I'm like, I can do this. I've been doing this for 20 years. I don't know how to do this.
Yeah, and I've taken classes before. I mean, where I went to school for NP, it was like a hybrid kind of classroom and also distance class. In the last year, they changed it. I've taken online classes in Alaska just because of location, but the forum is just completely, working through the format. Always the first quarter is difficult because you're not used to it. You're not used to using anything. So, okay, so let me see here what I'm looking for. If I can figure out how to get to it. This is like probably my biggest thing. Assignments. That's probably where I need to go. Okay. So week 2, partner Zoom dates and links and therapeutic video. Okay. Did you happen to send the date and link already?
Yeah, I sent that, and I figure I don't see why both of us have to send that. I think that's just in case she wants to join in. Right. So I sent the link and the date and time. So she has that if she wants to.
Yeah, I can just resubmit. Post the Zoom link here along with the date and time. Okay, well, that's fine. We'll do that later. And then assignment. Okay, so here we are. We've got week 2. Okay. Are you able to pull up the video again?
No.
at all? It's
I'm so
completely gone?
sorry. I can't.
That's okay.
I thought it would at least save it on the Zoom little channel there, because
Right?
I have that set up, and it shows that it was a meeting, but when I pull it up, it's nothing.
Oh no, so maybe it just didn't
So
save it or something.
I thought I did. I'm so
Yeah,
sorry. I
that's
got so
okay.
confused. I'm going to do it very step by step. I think I was a little rushed. Um,
Yeah, that's okay.
Now, I did do the journal assignment,
Okay.
just kind of looking back. I thought you did a wonderful job. I mean, I could really sense, when you were role playing, I could really sense the frustration and the anxiety. I said I hated my cadence because I was so totally off. I can't. There's a commercial that plays and it talks about teletherapy or therapy over text. And every time it does, I have this violent response and I go, no. Because I even put that in there. I said, you're missing so much, because there were times when you were doing the role of Eleanor where if you were in person, I would have kind of put my hand on your hand just to kind of, let you take a breath, because I guess I'm very touchy feeling and I'm like, I can't do that. And plus there's like a little delay. So I think I just need to slow down and not be so anxious.
No, I think you did very good. I think it's,
You're sweet.
to have it to be, I think it's supposed to be, now this week's video, it doesn't look like it has a time frame.
She did send an email for clarification, because I think a lot of us were confused.
Mhm.
And she said it should be about 10 to 15 minutes of each person. Like for the first 10, 15 minutes, one person is the therapist and one person is the client, and then you switch.
Okay, that would make more sense to
So
me.
that does make more sense. So I think in that way, it's the same client, and basically it read to me, use your self-reflection and do better. So, which hopefully is what self-reflection does.
I would hope so. Okay. So let me see here what we've got.
Looking at my printout.
So I'm a little confused. Like the journal it doesn't allow you to upload it, but we're using it to, I don't really understand that.
I guess it's more like just kind of reflect on how you think you did last week. And I feel bad because you didn't have an opportunity to role play therapist.
Okay.
I just always, on those, I'll type it on a Word document and then copy it. And I just happen to have my Word document open, so
Oh, well,
I
that
just
makes
printed
sense. Okay. So
my
then your
Rambling
system,
Bond.
are you just submitting it at all, or are you just not submitting it? Because it
Oh
doesn't
no,
really.
I submitted it. When you have that thing for the journal, you have a little button that says Start Journal, and you can just kind of type it in there. But instead, I typed it on a separate document and then copied and pasted and then submitted it there.
Oh, mine doesn't have a, I don't know if it's mine because I'm doing this on a Mac, but it doesn't have a submission ability.
Oh.
That's why I was confused about that, because I'm looking at it and I'm like, why does it get us? It just has comments. It just says, this assignment does not require you to submit anything online.
Let me
Week 1 journal,
and see what
self-reflection.
I'm going to pull mine up and see what.
Oh, there she's a
It's
Q&A about uploading assignments.
Yes, which I'm hoping someone else had as much confusion as I did.
Okay.
I put that over here. So how is Florida doing? Are y'all recovering?
Yeah, they seem to be okay. We've got some people from the East Coast still over here at my facilities here. That's been a
Okay.
little chaotic and people are burnt out. I mean, so when I talked to you on Saturday, I actually ended up getting called later on that night to drive back over.
Oh my goodness.
So one of the facilities on the East Coast, I don't know if you remember, but there was last time with Irma, we had generators die, and there was somebody in Tampa Bay area, the nursing home that a lot of people, like 12 patients, died in.
Is that the one that they had the lawsuit?
Yes.
Oh.
So part of that requires now the nursing homes and ALFs and things to report their generator status. And one of the generators went out. And so they called because many of the people that I work with were already they were just all sprinkled up and down the coast with the different facilities that we have. And so they called and said, is there any way that you can drive over with this crew? We're delivering the generator and some supplies, and people are getting burnt out. Can you just go back over one more night? And then I ended up there Saturday.
Oh my goodness.
So Saturday night, late night, showing up, getting the generator, checking out and giving, relief for some of the people. And then I ended up going up to North Carolina to deliver more supplies so that they could kind of get into the Outer Banks facilities up there. Yeah. So I ended up driving all the way around and then ended up having to pick up my kids on the way back down because their dad met me at the border of Georgia and Alabama because they had already missed 3 days of school. So it really wasn't a weekend at all. And that's what happened. So I intended to do homework all this weekend, and it's just a mess. And now we're burnt out and had to come in and see patients, and the patients are, there's just piling up. There's
bad.
Like one no-show today, and somebody else was put in the slot. So I saw like 30 some patients today.
Oh my goodness. Oh.
So that's why I get overwhelmed, because I also feel old, and it's hard for me to really get the grasp of all the things because it's in different tabs. And I just want a piece of paper that says, okay, you do this, this, and this by this.
I find I have to do that Sunday night. I go through, well, actually Monday morning. To me, it's night. When you work overnight, you flip everything, as you know. I go Sunday night and I just make a list of everything. I mean, down to there's 3 videos to watch, and I need to, print these PowerPoints, because to me, I need to print it. I need to hold it in my hand.
I do too. I'm going to have to do that. I've got to re-ink my printer because it's dried out because of the humidity in Florida.
Well, she did say she was going to be flexible with the date of the first week, so I'm sure she's going to understand. I mean, my goodness. So. Wow. All
right. So I get the gist. I'm reading her updated about the workbook and video assignments.
Yeah.
Okay. So 15 minutes each is the psychotherapist, about a 40-minute time slot, recording in the same video and link. Okay. So each of us should be 10 to 15 minutes. I have to also upload the meeting information, date, time, and link. So I guess I'll have to copy that link that you sent me. And what email do you have that you're putting in there?
For you or for me?
For
me,
you,
I have the, actually, I just typed the link to you. Your Regis one is what I was sending it to.
Because I didn't get either one of them.
Oh, you didn't?
No, I didn't get the one last time either. The only way I was able to open is when you messaged it to me.
When I messaged you, okay.
Yeah, so I'm wondering if it's ending in like a junk. Let me look and see now.
Because there is a thing to send an invitation.
Right, and you have my email, so it's that's really strange.
I'm gonna have to. I am so sorry. I don't know how I am messing this up. Well, because I don't understand it. I'm gonna have to sit down and really go through it.
That's okay. Let me see here if I can figure this out here. Okay, so then save your videos with the name as followed before uploading to the Dropbox. So we need to do week 2, your initials and my initials.
Yeah.
with the hyphens. Okay. And then all partners for a group should be uploading the video for grading as well. So I guess you'll have to email me both the link and the video.
And I had that for last semester. There was something, PowerPoint presentations we had to upload to a private YouTube channel. So I know I have that.
Oh, I'll have to look at that. Oh, so you're still going for FMP, or you're still going for PMHMP total, right? You're not an FMP.
Right. I mean, yeah, I started way back over and started back in nursing school. And, you know, so it's a total, at first it was a career change, now it's a career merge. So
I get it. I just went to nursing school myself. When did I graduate? 2016 with my accelerated BSN. Before I was a lactation consultant for WIC. I worked for 12 years, and I worked for Indian Health. Yeah, so I did women's health and children nutrition for 12 years.
That's great.
Yeah, it's fun. It's just like, I mean, therapy. You know, it's kind of therapy in a way too. All right, so let's see here. It doesn't look too daunting. I mean, figure out how to do this Zoom thing. Okay, so I guess the only thing that I'm a little not prepared, I mean, not a little, a lot not prepared for is exactly where we're kind of gleaning the information as to what we should be doing. That's what I'm trying to
I know I pulled this off. I think when you go into, it says something like, video revisit. And I printed off just because I have to, because 2 windows open, I won't be able to see your face. And that's where it says this week you'll need to meet your partner. You were reading this. Talk about your journal or self-reflections, and then after verbal discussion with your partner, record therapeutic video, revisit the same case.
Okay.
Basically just do it one more time.
Just kind of look at, so really we're not using specific techniques that we've learned per se just yet. We're just kind of trying to feel out the field. Is that what I'm understanding?
I love that part. Well, I feel bad you didn't get the book. I had some problems getting the book. I ended up buying it and renting it, and the rental book came after the one I bought. But they did say in there what we've been saying all along is, look, you go to school, you learn these techniques, and the whole thing is, are you making a connection? You know, that's the only way it works. She did have in the journal stuff about transference and countertransference, and I'm like, yeah, I don't think that's going to happen in the first session.
Right, where did you see that? In the journal?
Yeah, well, I'm one for, if you give me instructions for my journal, I'll go 1, 2, 3, 4, 5. She did say something about, you know, did you think that was happening? And I was like, yeah, I don't think so. I think there was a certain.
That's what I'm looking for. I can't seem to find. That's what the guidance is. That on like the
guideline for week 1 for self-reflection journal. She had a list, and it was a long list. It was maybe 12 things. Because I printed mine. Let me find it.
If I can find it. This is the part that I hate. I hate having to dig for things that are confusing to me.
It must be different on a Mac, because she even had, if you would see this client again, what things would you do for a treatment plan?
Oh, I think I have it here. Let's see what I've got here. Is it under Journal 1 self-reflection?
Yes.
No, see what it tells me is it says you cannot enroll yourself in this course. What does that even mean?
What?
Every time I click on her link, I'm going to have to email her.
Oh, that's bizarre.
Yeah, so when I click on those, when she goes and gives all that information, it tells me that I can't, I don't know what I'm trying to do.
My goodness.
I might just have to do the 20, I might have to just reach out to the help support people.
Yeah, because I'm clicking into it now, or I'm trying to, it's down under journals. Okay.
Might be able to try it this way. Okay, week 1 journal self-reflection. Let me try that. There we go. I got it. If I went another way. Yeah.
It's the list. Yeah.
Okay, there we go. Okay.
What skills did you use? What readings?
Okay. Yeah, well, I'm definitely behind the curveball there.
And that's where it says start or edit your journal entry. And when you do that, you just save changes in it. Changes.
Okay. Okay, so I think that's fair enough. I mean, we can definitely go over this stuff. So tell me what you want. You want to go first since you have yours already?
Sure. I have it printed out because
Oh,
I'm
good
old school.
job.
Um, I just said basically it's the basic empathic listening skills, paraphrasing, checking for an understanding. Um, I think the most important thing, they talked about general characteristics of a good counselor. And I thought the main thing was just being sincere, being authentic,
Absolutely.
because we've all run across those people that were, and they're just thinking, stop talking so I can tell you what I want to say.
Right. Or they're
You
just
know?
like, let me finish charting and then you can leave my office.
Yes.
Right?
Looking discreetly at your
Mhm.
watch.
Mhm. Or straight at the computer.
Oh, I can't do that. When I was doing an emergency psych, they said, take your computer with you into the patient's room. And I'm like, not going to happen. I'll make notes.
So that's how we have it set up in outpatient. The first outpatient I worked at was paper charts, which was nice. It was quick,
Yeah.
just one quick note. So you could really spend a lot of time with the client. Now what it is, it's kind of more formal. It's a desk and they're sitting
Yeah.
across you. So there's already that barrier. And then the computer's to the side. So you're literally like this. So I always have a difficulty keeping up on my charts because I want to interact rather than.
Right.
So I will interact, jot notes, and then spend all night charting, which burns out really quick. So
That's what I do. Maybe the kids can do it that way, but I just cannot. I can't.
yeah, I just got dragon dictations and hopefully it'll help. But
Oh, yeah. So, it asks about strength and, I did say I think I had a lot more weaknesses than strengths because I think that what I did, and I should not have done this, is I read through the scenario because I wanted to kind of memorize it. And then I had in my head, you know how you do a little scenario in your head? You weren't reading my mind, and I went crazy. But I think that was a lot of anxiety. So my whole thing was just let it happen. I was just too much control there. I did say that there were extenuating circumstances. I just felt horrible for you because I thought, my gosh, this poor lady, you have all this going on. You had to meet in a Starbucks. Um,
I spent my whole
resiliency.
career in college doing this stuff. I literally would take my kids to the park and I'd be sitting in a corner of the grass, So you got to do what you got to do. It's no big deal. I hate
Yeah.
adaptability.
Well, I just so appreciate it.
I appreciate you too.
Oh, sweet. But I think I did a little more than I should have done. I kind of really felt, I really could feel this anxiety coming from you. You did such a wonderful job. And I really felt you needed something. So, and I probably shouldn't have suggested journaling or something, but I thought, I can't leave you with nothing.
Well, I would disagree. I think that you empowered me as a patient with something that was tangible and quick. Yeah, absolutely.
Yeah.
Because, when I see patients every day, the medications, they take time. There isn't always a lot of them have to be built up. And even with the quick fixes, it's empowerment to be able to write down and let out that stuff. So I think that was a great idea.
Well, thank you. Yeah, I thought it was fine. The only thing I said is, if I were to meet with this patient again, they talked about treatment plans. And I said, of course, you're doing that with the patient, but I would want to do some quick calming techniques for her. I always teach patients the 5-5-5 breathing, just because you can do that. And I explain to them, look, when you have anxiety, your mind is racing, your body's racing, you can't think, you need to slow down. The oxygen is not getting everywhere it needs to go. The quickest way to do that is, the 5-second inhale. And I tell them, put the Mississippis in. Because it's not 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5. And, I thought that she could probably benefit from some education about the opioid crisis, because that seemed to be her core issue, which I could certainly understand. And I thought, gosh, I hope this fictional kid doesn't vape too.
Well, they're all around here. That is a very real scenario around here.
Oh my goodness.
The elderly and the sandwich generation, they're all living multi-generations in the homes with grandparents.
Yeah, it's a toughie. But then I did always put, because we're trained this, medical first. Rule out medical. Let's give her a physical. Let's talk about medication, because what did my old supervisor would say? It's the quickest, most effective way to make a change. And then after a while, talk therapy is going to make the same change in your brain. But you just have to work it out. But that's pretty much what I had.
I think that's great self-reflection. I think for me, if I would look at skills that I used in the session, I would say there's probably some validation, giving the validation and kind of looking at being open, and disclosing things and not being guarded, or, wanting to really be accepting of the care and accepting of the therapy. And I think that's a big piece that many patients don't always have. Sometimes they come in very guarded. I would say, as far as the assigned readings and things, just going through, the handout. I was kind of the patient. I didn't really do the therapy part, so that kind of did me a disservice, but whatever. That's okay. Hey, son, can you turn that down, please? Sorry, my son's playing a video game.
That's okay.
So I'd say, strengths of my role in the interview would be then is that I felt like I was pretty good to be able to convey kind of the scenario and play the lady at a disadvantage. I have patients like that all the time. So I actually had one today. I was actually thinking about this interaction.
Oh my goodness.
Yeah, I would say weaknesses and areas needing in further development interview for myself is just time management with having all this stuff prepared in advance. I think I definitely need to get, on track this week and reading through what we need to do so that when we come together, we're both really getting into the meat and potatoes of what the assignment is.
Right.
So I think that's a goal that we could do definitely going forward.
Yeah, that's definitely a goal of mine, is to get the Zoom down.
Yeah, definitely. And for me, it's, the books and stuff. So I know that I was able to get an online version today while I was at work. So I'm going to do that tonight. Improving my interviewing skills definitely can improve that all the time. I think that for myself, just when I'm thinking about my work, sometimes there is that eagerness to help.
Yes. Let me fix it for you.
And some of my patients today, like an example, I had a couple and they talk very slow. And so you have this time constraint, the waiting room's full of people.
Yes.
And you're trying to be patient, but at the same time, so you're trying to direct at the same time, so you'll say, well, do you mean, and then they'll go, no. And then it'll go all over again. So one of the things that I need to learn is to have that pull back and just say, let them express themselves and then assess at the end.
Yeah, I think a lot of times you're meeting with someone and you know where it's headed. You're like, okay, I know what's going on here. They don't know it yet. And it's hard to let them come to that understanding. It's so much more powerful. They're like, aha. And you're like, way back in the 90s, when I was in school for therapy, our instructor said, everybody's got a secret and everybody else knows what it is. And when they finally tell this horrible secret that they think, they've been hiding, people are like, yeah, I know. And I think sometimes that's so true. With patients is they come in for one presenting and you meet with them and you're like, nah, that's not what's going on with you, but you'll see. Yeah.
That's very true.
It happens.
Yeah. I had a patient, one of my last ones today, he is very introvert, and a lot of alcoholism and got in a lot of trouble. He's almost 50 and very shy. And at the very end of the 20 minutes that I had with him as a follow-up, he squeaks out and just like, I have to confess something. 10 years ago, I was in a hospital and I found a bottle of full Seroquel prescription and I took it. He was like, I was stealing, and I'm like, he was perseverating over this, and I was giggling. I was like, to be fair, yes, that's the wrong thing to do, and yes, it's okay. And I actually prescribe you Seroquel at 50 milligrams, so how'd you feel on the higher dose? But it was like a little secret, and once he let it out, he was just like.
What a great moment, though. He's like, okay, I can trust this that I've been living with for 10 years, and now I can finally share it,
And you're like, yay, but it's really no big deal. No, you don't say that. But.
I know. That happens. You're like, yeah, okay.
Yeah, but I'm really glad that you felt comfortable enough to tell me that. And, so, it's fun. I find it fascinating. It's a very hard profession, but when you learn the tools and you do these kinds of things, that's why I think this is a great idea. At first I was very nervous about it, but now I love hearing your ideas and I love talking with you and I look forward to that. And I think it's a great learning experience.
I think so too. My first master's was at WVU and it was very experiential. Now, again, this was in the 90s, so experiential meant that they bring in an actual video camera and videotape us.
I remember those.
Yeah. And at one point, one of the visiting instructors said, well, I'm going to have to give you a final. And we're like, no, Dr. Thilov said we don't take finals. They just videotape us. But it's good because you learn that and you see how it comes, and you practice it, because their thing was you're either going to get this or you're not. But if you don't make a connection, why even bother?
Very true.
And then the other thing I'll tell you, which I absolutely loved, was one of the instructors said, well, now, you may have a patient and you're working with them and you're really working hard and you're really trying and they're trying, but there's just no connection. You're just, missing each other. And he said, you only have to ask yourself one extremely important question. And I'm ready to write it down. And the question is, who the hell do you think you are?
That's great.
Isn't that fantastic?
That's so great.
You're not going to have a connection with everybody.
That's true. That's very true. And I do tell my patients that because we have, we're community mental health, so it's limited income. There's very few options if you don't go with us. And I'll have some clients that are like, really want the therapy and they don't have a good connection. And I'm like, it's just like a marriage. Yeah. And you're paying someone's paying for it. So don't feel bad if you gave it a shot and you need someone else. Right. You're not going to get along with everyone. You can be the ripest, juiciest peach and someone doesn't like peaches, right?
That's a good one. Yeah. And really, I think if someone changes, both the client and the therapist, when they change, are like, oh, good.
Yeah.
I'm dreading that.
I would love to disengage from a few folks. Oh, funny. Well, let's go through these other things here. Let's see.
Okay.
Improving my interviewing skills. I definitely think for me, transference and countertransference are all things that I need to be more cognizant of. Yeah. I do find sometimes throughout the day, I do get a little bit of that.
Yeah.
Anytime I felt stuck or uncertain how to respond, I don't think neither one of us did. I think it was just as if we were really just meeting each other for the first time, which we were. I felt it was a very real, raw emotion.
I thought so too. I mean, I'm telling you, you gave me so much to work with. It was fantastic. You just threw yourself in there. And,
been an actress.
You should have been. And, with transference, I remember one time reading the work happens in transference, because a lot of times, how people are recreating and, and forgive me because so much of my work was in play therapy, but, play therapy, the child is recreating, right? Well, I think adults, they're recreating through conversation. So if they have that transference and they're looking at the therapist and they're thinking of whoever the issue is with, they're really doing a role play. So there's really a lot of work done in there. I understand, I agree with it's sticky, but I had read that once and I was like, you know what? That makes sense.
That does make sense. Almost like an adult play therapy in a sense, right? Yeah.
Well, I mean, it is all practice sometimes, that's what they're doing. They're practicing their options and they're thinking about what to do, So when I read that, I was like, no, I got to look this up because I know somebody told me that the work is in transference, and I think it is. You're recreating the good friend or the good partner or the good parent.
Mm-hmm. You do, and and many people need that connection, even if it doesn't, that little bit of transference is, we want to avoid that, but you're right. I mean, there has to be that connection, that reliability, that, this is a person that I can trust.
Right.
And that safe space. Absolutely.
And they say, who really listens to you? Who really, it's most of our connections are, okay, you're going to tell me about this patient. Keep talking because I got to remember to tell you this. And you're thinking, what did they say? You're not thinking about listening. You're thinking about your response.
Yep, that's right.
Which I think early on you do because you're thinking, okay, I have to come up with a pearl of wisdom for this person.
You're right. Though that's true because when I first started doing this, I was so on edge. Like I was so nervous and wanting to be and do the right thing that I just dangling. And then I was like, okay, this is what we're going to say. And I was so busy trying to formulate that I didn't just listen.
Yeah.
So the psychiatrist that I worked with, he was very busy practice. He basically just said, sink or swim. And he threw you in. And he said to me, and it made a lot of sense. He's like, you're not here to fix all the problems.
Right.
But you got to figure out what the problems are.
Yeah.
Listen.
Yeah.
And if they go off on the bunny trail, bring them back.
Right. And sometimes you'll say something and they'll look at you like, are you kidding me with this? Have you even met me? And then you're like, okay, now we can focus in. Now we can, connect here.
Absolutely.
So,
yeah.
God, therapy's great. Don't you love it?
I love it. And, in many ways that I find it fascinating is the dynamic. So each patient, you have to find something that connects to build a rapport, and how you talk to them and how you react to them is a dance. I always like a dance. Every patient is different.
Yes.
This older lady who today, she needs a friend and something she thinks, wants to share, and she needs a little more comfort. She needs a little more hand tapping or, whatever.
Yeah.
And she'll hug you at the end, or then you get the guy that's like 6'4" with the tattoos who's very brisk, and, you just need to build a little rapport, maybe, tell a clean joke or two, or, so that's the piece that I find fascinating, is that every person presents with their own unique situation.
And I love that you call it a dance, because it is.
It is a dance.
You nudge up and then you go back, and then,
And you got to be keen on those times when they get guarded, when they don't like what you say. And you have to be humble. I have one young man who got very guarded about something, and he had misconstrued what I said. So then I immediately stopped and said, I must apologize. That's not how I meant to convey it. And then immediately it melts off, and he's right back in being engaged, because we're human. We're not perfect.
Yes. And if there's a strong reaction, you hit a nerve. You found something there,
Yes. That's very, very true.
Oh my gosh, I'm so glad you're my partner.
I'm so glad you're mine.
Oh my gosh, I'm learning so much from you.
Well, same here. And that's what I love, that you have the therapy piece, because all that I do and I know is just from instinct, from working at WIC for 12 years, talking to moms and kids.
Yep.
And then doing this piece, working in the hospitals and just building rapport with patients. So I never had, I don't know, formal things I know countertransference and transference and those kinds of things as basic things, but I'm really looking forward to even delving further into this and getting more of those nuggets of, specific things, putting labels, so to speak, on, and be like, that's what that is. This is what we do. I'm just feeling it out now.
And there's that thing, oh, I don't want to label anyone with a diagnosis. But think of it the other way. If someone doesn't know what's going on, you say, you know what? Often people who have this thing called bipolar disorder have these similar symptoms. And you think that person's probably going, wait a minute, one, it's not just me. And you have an understanding, so you can help me.
Absolutely. And I always tell my patients it's always a working diagnosis, unless it's like super very clear cut, grief or something happened and, but I always tell them that. And I tell them that it isn't about their diagnosis because that's not they're a human and they have symptoms. And I treat symptoms. I don't treat words. Right. Words are for billing, labels are for billing and giving kind of just a guidance as to what kind of medicine. So I always, when that happens, I always discern the difference between antidepressants and mood stabilizers and what can happen to someone who has a mood disorder and they're given an antidepressant and why. And I draw a diagram and all my patients, they all tell everyone, like I do that because it empowers them.
Exactly.
And when they come back, they're like, this is why I have to have Zyprexa and I can't be on Lexapro, so.
Perfect. And I need to learn that. I need to learn these medications because you said last week, oh, who put her on Buspar for this? And I'm like, make a note. Why do we not put on Buspar? What is wrong with this?
We can talk about that eye and the meds all day long right here. I mean, that's my strong suit. But still I'm even learning too. Everybody, the other thing the psychiatrist taught me was, even though psych medicines are a limited category, everybody picks a few of each that they like. Okay. So you have like the first one you go to for this, and you have a backup if that doesn't work. And then you got to learn the side effects and the interactions. But that's how I practice. And each one of the providers that I work with, it's the same thing. Like I prefer, if someone presents with anxiety and depression, my favorite go-to is Lexapro. Sometimes I'll give Paxil. But you know what I mean? It's just kind of like you have your little favorites. Okay. So you don't have to know every single one.
Well, that just gave me... that makes me feel so much better because the other class I'm taking is pharmacology. And I had said in that, this gives me more anxiety than anything because the only class I had was in nursing school and our instructor was lovely, but she did not speak English.
Oh, no. So I didn't learn any of these things either. I learned them all I graduated with my FNP last September. So everything I have learned is everything on the job. So when I'm taking the same class too, who's your instructor?
Dr. Don.
Okay, I don't have her. I have Monique Fincannon.
Oh.
For psych. So, and I've had her actually before at Maryville. She was my pharmacology. So she's awesome. And I'm sure the content is still the same. So if you need to, we can always talk and
that'd be great.
Help study and do stuff like that if you want to, because it's my favorite subject.
Well, I can tell you're like, oh yeah, it's this, and I'm like, oh, give me your knowledge.
And it's not hard. Like once you get it, you'll get it. I promise. And you'll feel much more confident. And the first 2 months, I was like, someone's gonna die, but you'll get comfortable and you'll learn what to look for. So don't worry about it. It's just like nursing, right?
Yeah. Yeah, nursing. I remember my first in clinical, I was like freaking out about giving people medication or even like checking their finger sticks. Now I'm just like, I'll go into a room and they're like, do you need to turn the light on for this? Nope. See you work. Okay, this is what you got. Okay, we're good.
Exactly. It's a skill. It's a learned skill. And remember that medicine is always about practicing medicine. We practice. Remember. That's right. It's subjective. Everybody does things differently,
Good to know. Thank you.
Yeah, no problem.
Okay, I could sit here and talk with you all night.
I know, same. So, should we get going?
Let's do our scenarios.
Okay, so let's see here. Okay, let me pull this up here real quick. So I have to go back to week 1.
Yes, it's Eleanor.
Okay. Hey, can you guys turn that down, please? Thank you.
I swear I thought I heard a kid say no.
He goes, yeah. That's what he said.
Sadly, when I thought the kid said no, he became my favorite kid ever.
He probably would half the time. Okay, let's see. Create a private and where's my little, that's the date and links. Create content. Therapeutic video. Okay. Okay, I need you to turn it down. Read, Sophia. Thank you. Turn it down or go in the room and shut the door, please. I got to record something, please. You got to be quiet. I don't know what they're doing right now, but it's noisy. Okay, I'm ready to go whenever you are.
Okay, do you want to be the therapist?
Sure, I can be the therapist today.
Okay.
All right, ready?
Yep.
Okay. So, hi, Eleanor. This is I'm Narlene. It's nice to meet you. I'm the nurse practitioner for psych. How are you doing today?
Well, I don't even know if you can help me. I am so exhausted all the time. I've been to different doctors. I've been to the emergency room. I don't know what it is. I just am tired. I can't function. They say there isn't anything physically wrong with me, but there is something wrong.
I'm very sorry to hear you've been feeling this way. About how long has this been happening?
It's probably been about a year.
Okay. Does anything seem to trigger it or set you off?
Well, the only thing I can think is about a year ago, I found out that my grandson, he's my first grandson, they're always the most special. You love them all, but it's the most special. He's been using heroin. And I see on the news this opioid crisis, and people are dying, and I don't want him to die. He's only 23. He's a good kid. He's not a bad kid, but I don't know what to do, and I keep waiting for the phone call that he's going to be dead, and I just, that's all I can think of. It's all I can think of, and I can't do anything else, and I don't know what to do.
I can see that this is very, very concerning for you. It's going to be very scary. A lot of the news coverage for the opioid crisis and stuff. Yeah. And I'm sure you love him very much. I can tell that he means a lot to you.
Yes.
Absolutely.
Yes.
So, when you talk about worrying and, feeling really concerned about these things, I'd like to hear and understand that a little bit better. So could you maybe tell me how you've been sleeping and how your appetite's been?
Well, my appetite has been off. I mean, I cook for my husband, and he knows there's a problem, and I try to talk to him, but you know how men are. They don't talk. But he's fine, but I can't eat. I toss and turn at night. I try not to watch the news, but I'll hear something or someone will say something. I'll talk to my friends and they say, oh, it's no big deal. Kids are kids. But I sleep maybe a couple hours because I'm exhausted, and then I wake up and I toss and turn and I get on the computer to look at the Google. Do you know the Google? And I put in the heroin, and all these articles come up, and all I can think of is I have to be awake for the phone call, and I'm just waiting for that. So I can't sleep, I can't eat, I can barely, I don't really get to volunteer anymore. I just worry.
That's very scary and very worrisome. And definitely reading things on the internet can be very educational, but at the same time, it can be overwhelming, and a lot of information on the opioid crisis, especially because it's been in the news a lot. And it sounds like, your grandson is at kind of a point where perhaps he needs some education as well as to what's going on, and maybe some different things we can talk as we get to know each other more about, maybe some solutions that you could offer for him that maybe help him along with treatment.
I've tried to talk to him. I've tried. He doesn't think I know what I'm talking about, or he'll say, oh yeah, I'm not using this. And then I find out that he is. And all I can think is one day he will be gone, and how will I go on? How can I go on? I can't go on. I can't go on without this child. I can't. My grandchildren are my life. I can't go on. I can't.
Are you in contact with the parents at all, or anyone else in the family?
I talk to my daughter, his mother. She doesn't want to talk about it. She says he's a kid, he'll be fine, they experiment. My kids, they experimented with the marijuana. I don't think they did any of the other things. They're fine, but that doesn't kill you. You know, I tried to talk to my friends down at the center. They have grandchildren the same age. They say that's just a stage, you know, but I know he's going. I just am waiting for the call that he's gone. He won't listen to me. He won't listen to his parents. I don't know. I don't know what to do.
Yeah, that must be very scary for you. I couldn't imagine how you must feel right now, especially if you're not feeling there's a lot of support with the family and not really feeling valid with these fears.
They don't understand how important this is. This is life and death, and people are dying all the time, and they just act like it's a stage. Like when he had the blue hair, he had the blue hair and the green hair and the spikes and the this and the that, and then he stopped. And then he got himself a nice little job, a beautiful little girlfriend, and now all he does is he lays around the house and he uses the drugs. And are we going to find him in the gutter? I don't know.
Has he had any kind of therapy or psychiatric treatment at all for himself?
They put him in one of these rehabs, and he was there for 28 days, and he came back. He was my little Charlie that I knew when he was little and hanging on my apron. And I went to see him a week later, and he's back. You can tell by the look. He's got the face like he's not there. And I said to my daughter that you need to get him back. And she said, oh, the insurance won't allow. So then he does the outpatient, and he's on this, what is it called? The methadone. Do you know methadone? But he says he uses the heroin too. He tells me, he says, Grandma, we all use heroin. And I said, in my day, we smoked a cigarette. You know, his mother smoked the marijuana, but that doesn't kill you. This, you take it once and then you're dead.
It's definitely a different culture these days, and you're right. The drugs are much harsher, and there is a crisis. And one thing that I like to take comfort in is knowing that the government has now stepped in, trying to control and curtail some of the things with the controlled substances and monitoring, overuse of the methadone and things like that. I think too, really kind of just working towards your anxiety and helping you sleep better and helping you feel better will also empower you, and getting a good night's rest maybe can improve your mood and help you kind of work through as we learn to get to know each other a little more as we go through our therapy sessions, and maybe we can come up with constructive ways to kind of help your grandson and help yourself as well, learning to kind of deal with this, because it's very difficult when we love someone and we want to help them, but it's also, we know that we can't control another person's thoughts, feelings, and actions, so we can only offer assistance and guidance. So I would like, if it's okay with you, to maybe talk a little bit more about some of your symptoms, and I would like to help you feel less anxious, that you're not worrying, and getting a good night's sleep and feeling more upbeat during the day, instead of having to feel anxious all the time. It's never a good thing either. We get our blood pressure up and our heart's racing. It's not good for our physical bodies as well. How's your appetite been?
I just, a little here, a little there. I've lost some weight, which I can afford to lose, but I feel run down all the time. The doctor put me on, it begins with a bupropion, and yes.
Okay.
And it did not work. And then he gave me Boost Bar, and I was so dizzy with that. Now, I take the lorazepam. I've taken that, since I was young, maybe 30 years. And a little pill, and he said, you can take it 3 times a day if you need to. And I've taken that, and it really worked well in the beginning, but it doesn't seem to be working as well now. But something you said, if I could get a good night's sleep, I think I could think more, but my thoughts, they just go, and I can't stop thinking about these things. What could happen? Where did we go wrong? What will become of him? I can't stop this enough to calm down and sleep maybe a couple hours.
Understandable. So there are different kinds of medications that help with anxiety, and it sounds like maybe just a little bit of touch of depression as well, where you're feeling kind of down and helpless to be
Yes,
able to help
yes.
your grandson. And I'd like to be able to help you feel better in that aspect. So when we look at different classes of medications, have you ever tried like an antidepressant or what we call an SSRI, selective serotonin reuptake inhibitor?
I did have something, they said it was an SSRI, but they had to do the blood work. And when they did the blood work, it was hyponatremia, something in the blood that was too low. And they said, don't take that anymore.
Okay. So hyponatremia is low sodium, low salt in your blood, basically. And so we'll have to, when we're looking at different options, we'll definitely keep that in mind. Boost Bar sometimes has a buspirone that you trialed before that made you dizzy. It can have that side effect. As well as the Wellbutrin can also not be effective for some people. And so we do have some other options when we're looking at medications. Now, I'd like to, before we discuss medications a little further, I'd like to talk about the lorazepam. So lorazepam also has another name, trade name, it's called Ativan, okay?
Yes.
And it's in the class of benzodiazepines. So benzodiazepines were actually meant to be short-term medications that you use for anxiety to kind of calm down things. And we do that short term as we build in longer term medications that you can take on a daily basis that build up in your system over time to help with anxiety and depression. So the lorazepam is very short acting and only lasts a couple of hours. So it doesn't keep a regulated, mood for 24 hours. That's how come you have it several times a day. So we're not really doing you service if we're, doing you justice if we're not completing the circle of 24 hours worth of medication to keep your anxiety at a nice level, reduced amount, and to improve your mood. So lorazepam actually can increase depressive symptoms actually over time, and you've been on it for a very long time. So
I did not know this. No one ever told me.
I'm sorry to hear that. So
I'm glad that you were telling me.
So I'm thankful that I can. So antidepressants, that's where that piece comes into play. So the SSRIs, the SNRIs, which are the Wellbutrin, the bupropion, those are ones that we give every day for long term with the goal of building up and decreasing the depression and anxiety. So what I'd like to do for you, Miss Eleanor, is I think we need to take a very cautious approach with your medication, given your history of what you've taken and poor response, as well as the concern with having the low sodium, low salt in your blood. What I'd like to do initially is perhaps look at some of your lab work. Have you had any kind of basic blood work done by your primary care?
Last year I had my blood work. I have an appointment for my annual physical. It is in 2 weeks, and he usually does blood work then.
Okay. So I think what I'd like to do is definitely get a copy of that.
Okay.
as well as if we can just sign a release of information to get whatever recent from a year ago
Yes.
baseline labs. That way it gives me a foundation to kind of just see where you are baseline
Okay.
level and check on your low salt in your blood. The other thing I'd like to do is I need to find out which SSRI that you trialed, that you took. Do you remember if it was something like Zoloft or sertraline?
I think it would begin with a Z. Now, my family doctor prescribed that. So you can ask him, but I think it was that Z one.
Okay. So we'll need to get a copy.
Zoloft.
Yeah, Zoloft. That's a very common one, very good first-line medication. So I'd like to get a release of information too, if we can get that information and
Of
find out what
course.
you tried before, because I don't want to give you something that hurt, that hasn't had good response in the past. Looking at those options, we could go forward and look at, I also like to take into account, any other medical issues you might have. So we need to discuss that and make sure that we've covered all your bases and make sure you don't have any kind of high blood pressure or high cholesterol and diabetes. And maybe perhaps even just looking at the most recent medical records from the hospital when you went in for fatigue, because they usually do actually labs. So that might be a good indicator of, some recent paperwork that might have listed whether or not your salt was low and things like
Okay.
that. And then going forward, I would still like to trial perhaps another SSRI, which is the antidepressant category. Looking at something perhaps like a very low dose of Lexapro, which is also known as escitalopram. It's a very effective medication for anxiety and depression.
Is that more salty? It
It
won't
doesn't
take away the salt?
it depends. It could. It always has a side effect of that. But we need to look at your most recent labs and see where your
Okay.
salt level is and keep
Okay.
an eye on things. Every medication has a certain class of side effects, and we could look at that. Depending on where that level is and the risk of that, because that's happened to you before. Other things can cause a little blood salt too, not eating real well. You've mentioned earlier that you have a real big appetite. So that might have been a little coinciding with, being depressed and eating and taking the Zoloft. You might have not been eating real well. So it's kind of tricky to say, was it really that, or could it be some other factors in there? The other thing we can consider is some of the newer medications that they have on the market for depression. So something like Trintellix, very good.
Trintellix?
Trintellix.
Trintellix. That sounds nice.
Yeah, so it's a good medication with a lot less side effect profile because it's newer. So that's another medication we could talk about too. So we need to kind of get a good picture of your medical history and go through all of that. And then I can maybe make a decision together. We can talk it through and get you on something. I think for right now, the lorazepam is still a good idea because you have anxiety.
Yes.
And you've been on it a long time. And unfortunately, when we've been on a benzodiazepine for a long time, the body also gets physically attached to it.
Am I addicted to it? Is it an addiction? Is it like an opioid?
It's not an addiction like an opioid, but
Okay.
the body physically, likes it.
Gave me agita.
Oh, I'm sorry. I didn't mean to do that.
It's okay.
Please, but make sure we don't want to increase your anxiety at all. But I did want you to know, so that medication just can't be stopped. If we were ever to look at coming off, because the body is so used to having it, it could get sick if it didn't.
Oh.
So we want to make sure that we continue that for right now as we look at long-term options. And then we can talk about maybe perhaps if we can get you at a nice, good place with some long-term medicines, you may not need the lorazepam anymore.
That would be nice.
Yeah.
That would be nice. Oh, I feel better.
Wonderful.
Because
that's wonderful to hear.
It's like a plan. I thought nothing would work. So I feel better. So what do I do now?
Well, I think what we could do is we could go over your medical issues and see
Okay.
if there's any kind of history medically that I need to be aware about. We'll look up
Okay.
these medications and decide what we could do and get some release of information for those lab work. And then we'll work together to come up with a plan on what medications we'll use, and then also going forward with what we'd like to work towards with therapy.
So
So,
we can talk more?
yes,
I
absolutely.
like talking to you. You're so young, but so smart.
Oh, thank you.
You make me feel better.
Oh, thank you.
Oh,
I appreciate your compliments. That's my goal. I want to help you feel the best you can, and I think together we can come up with a good plan and addressing all of the pieces. So sleeping and the anxiety, but also talking and working towards a goal on how do we help when it times come for that anxiety, when it gets really, really bad and you start to get where you're worried in that space where you start Googling things, that kind of can sometimes increase the fear. So working on some things like deep breathing, relaxing, taking just a minute to take some nice deep breaths in through your nose and out through your mouth.
I'm going to try this.
Yeah.
That feels better. I don't know why.
Well, you take a nice deep breath and it kind of, if you're focusing on that, it distracts from those thoughts and can help reduce your heart rate and reduce your blood pressure, which calms the body. So if we can practice together on things like that and working on some calming techniques to kind of help you when you start to feel overwhelmed. I like to call it a toolbox. So if you
A
walked around,
toolbox.
yeah, if you walk around with a toolbox, right? Everybody likes a red one or a pink one, whatever the color it may be. I have a pink one personally. You walk around. If you don't have any tools in your toolbox, you're not able to fix anything. So the more tools that you put in your toolbox, the more able you are to fix whatever it is that needs to be fixed, right?
This makes sense.
So everything that
Finally.
so everything that we're going to work with together and things like the deep breathing and the medications are all little pieces of tools that go in your toolbox.
I like that. Plus, maybe I can go shopping. I'll buy a toolbox, actually, so I have it. It reminds me. Something in a pink or a purple.
So,
Thank you, thank you, thank you.
you're welcome. So I think that's pretty much it from my end.
That was really good.
Oh, thanks.
I became one of my patients that I have now, I realized.
That was great.
The
And
patient from New York.
when you were spelling, I was like, you're like B-U-P. Is that the Google? That was my favorite part of all. That was classic.
Do you have the Google? I had someone who asked me that. Do you know the Google?
That's wonderful. I'll never forget that. That's great.
That was really good. I like the way that you explained about medication. Because I'm sitting here thinking, wait a minute, what? Let me write this down. That was good.
I know that's my hard piece. I'm sure that was probably just supposed to be therapy, but that's what I'm.
No, I think that
medication piece.
that's therapeutic because so often people take medication. They don't ask what it is or how it affects. And, especially with this patient who has a family member, she's dealing with that. She may not understand how that affects that too. And, I'm working in a rehab center, not that kind of rehab. It's half skilled nursing, half rehab. And a lot of the patients, they do not want to take their pain medication because they say, I'm going to be one of those addicts. I don't want to be one of those addicts. It's like, no, you're taking it as prescribed.
Yeah, I have facilities that are like that too. I have some SNFs and ALS, and because I have two jobs.
Oh my goodness.
I do outpatient and then I do rounding. Yeah. So that's similar. I do see that. I also see the facilities themselves not wanting to, they're trying to wean them off their psych meds to meet that certain percentage. And that is,
yeah, don't do that.
Yeah, it doesn't always work.
I've been on this forever. Well, I think I get a do-over if you can indulge me for a couple minutes because I know it's getting late. I'm not going to, that's a hard act to follow.
Oh,
but
I got an upper hand, remember?
What's that?
I got an upper hand. It's not fair.
Yes. Okay. So, okay, I'm not Eleanor. Okay. Well, hi, Eleanor. I'm Melanie. It's nice to meet you. Can you tell me what brings you in today?
Hi, Melanie. I just, I've had this really bad time lately, and I've just been really, really tired, and I'm very anxious, and I just feel very wound up for about the past year. I just feel so anxious. Everything just sets me off, and I'm shaking, and I'm just frustrated, and I'm just so tired. I can't do anything that I like to do.
Oh my goodness, that must be awful. So it's been going on for about a year?
Mhm.
So tell me more about this anxiety. Is there anything that you were doing a year ago that you can't do now? Are you sleeping? Are you eating?
Um, about a year ago, I think it's when I first found out that my grandson, he's using the drugs. He's on it.
Oh,
And this whole opioid crisis thing, every time I turn around, I see it in the newspaper. I'm hearing about it all over the place. Looking on my phone or trying to figure out on how to get on the computer and read more about it. And I'm just so very worried about him. Like he's just using those drugs and he's gonna die. And I'm just so worried about it because he's my baby and I love him and I'm worried that he's gonna get sucked up into this big opioid crisis thing and no one gets it.
that's scary. So this has been going on for a year. So let's talk about how it's affecting you. You say you've got the anxiety, you're scared. Um, are you able to sleep?
No, I
No.
wake up, I'm 72 years old, so I don't sleep a whole lot. My husband snores, so
Uh,
I help him. And I find though I used to be able to drink a nice cup of tea and wind down in front of the telly and get about 6 hours of sleep. And now I can't sleep. I lay in the bed and I'm tossing and turning and I'm thinking and worried and my thoughts are all over the place and I just cry and I get real sad and then if I finally do fall asleep, I keep waking up. I mean, I have to wake up to use the bathroom too. But, a lot of times lately, I've just been waking up and I just feel so anxious. Like my chest is tight and I'm just so scared. Like I've had a nightmare and then I'll wake up at like 2 or 3 in the morning and then I can't go back to sleep. And so then I'm tired all day long.
I bet. Now, have you tried anything in the past year to deal with this? Have you seen a doctor?
I have. I go to my doctor. I've been with them a long, long time for about 30 years, and they were real good to me.
Good.
I didn't have any problems before, worried about my grandson
Yeah.
a year ago. But in the past year, I tried this stuff and Boost Barone made me dizzy and lightheaded, and they said that was supposed to make me less anxious, but it just made me feel like I was gonna faint all the time.
Oh,
And the bupropion they gave me, it just didn't work. I still was anxious all over the place. And then I took something else. It was something depressants things, and that gave me something called hyponatremia.
oh, okay.
I don't even know what that is, but they said I had to stop taking it. So right now, I mean, the only thing I've had, and I've been kind of always a worrier. So for the past 30 years, I've taken lorazepam. I take 0.5 milligram. I take it up to 3 times a day. And
Okay.
in the past, I'd only needed, here and there, maybe once or twice. But now I'm finding I'm using all 3 times every day, and it gets me calm for a little bit, and then I'm right back at it.
Ah, so there's a lot of different medications out there, and the reason is because they all work differently with different people. So sometimes it's hit or miss. Hyponatremia means a low sodium. in your bloodstream. You need a certain amount of sodium to function. Your brain kind of runs on that sodium. So when it gets too low, we get a little worried. And if it was the medication, then they would take you off that. So we'll probably want to talk about medication. Other things, have you tried talking to someone about this? Do you have any support?
Well, other than my husband who snores all the time, and he doesn't get it. He just thinks I'm being a woman. Not really. I mean, he doesn't understand. He doesn't really care. He doesn't like to talk about it. He thinks I'm just overreacting. Because men are just different. And I mean, I go to the senior center, and I've tried to talk to my friends there, but they just don't understand. And but I'll bet a lot of them have these family members that have the same problem that my grandson has, and they just don't know it. They're not aware like I am. And I feel like, when I get those thoughts, that I get so frustrated and nobody listens and nobody cares, that I just don't know if I'm going to make it. It just seems so overwhelming to me.
Well, I can tell. It seems like you get so anxious and overwhelmed. Now, you mentioned, feeling like you're not going to make it. Do you ever have any thoughts of hurting yourself, of killing yourself or anything?
No, just sad. Just feelings I just don't want to get up and.
Yeah, like a depression maybe. And depression and anxiety are best friends. We often see them go hand in hand. But the good news is there's a lot of things that we can do. One thing I will tell you, you can't fix things for someone else. If you could fix your grandson, he'd be fixed, right? So I can give you some more information about that. We can talk about ways to support him, but we can't fix him. But what we can do is talk about some things to help you cope with this better. Unfortunately, you're right. We are experiencing an opioid crisis in this country. It's very bad, but there are a lot of people who use these opioids, and it's a phase. They'll work through it. But I can understand it's your grandson, you're going to worry. But the best thing to do, that thing they say when you're flying in an airplane. If you fly in an airplane every now and then? Well, you're sitting there and the stewardess comes on and they always say the same thing. In the event of a problem, a mask will come down, right?
Yep.
Do you remember what they say?
Put it on me first before the child.
Put it on you first before the child. Because if you try to help the other person and you're not helping yourself, you pass out, you can't help anybody. So right now, our focus is going to be on you. And there's a lot of things that we can do. Medication, like I said, there's a lot of medication out there. We have to find the best one for you. Medication is the quickest, most effective way to make a change. But here's how it goes. My job is to make the best guess. You've given me a lot of information. I know that you've had problems. You've been on lorazepam for a long time. Probably worked okay in the beginning. You're saying not so much now?
Yeah, not very long at all. Initially, if I take it, it calms it just a little bit.
Yes.
It just doesn't.
That's because lorazepam, that's how it's supposed to be. It's supposed to be every now and then if you need it and it helps you calm down and you're out of the situation. You've been in this situation for a year, so you need something that's going to stick in your system longer. And we already know you've tried some things that haven't worked. So my job is to sit with you and say, okay, let's look at you. Let's look at you physically. We'll do a physical. We'll get some blood work, see how you are now, and we'll talk about medication that can best help. So my job is to work with you to find a medication that can best help. Your job is to take that medication and let me know how it works. Okay? So if I give you some medication and you're feeling dizzy, like with that, let me know. We can try something else. The lorazepam will let lie for a little while. Keep taking that because that's helping you short term, but we're going to try find something that works longer term.
That sounds wonderful. That would be great.
Now, in the meantime, there's a lot of things that other things we can do. When you take medication, it causes a change in your brain, okay? Your brain runs on chemicals, medication's chemicals. So all we're doing is fixing that with the chemicals. But they have found that just talking about what's going on and working through it makes the same changes in your brains. It just takes longer. So we can talk more about what's going on. The other thing we can do is I can teach you some things that'll help you, because right now your brain's racing, right?
All the time. My thoughts just won't stop.
Yep. And when that happens, your body, there's this thing, do you remember fight or flight? Do you remember hearing about that?
Yeah, either run away or start
Or fight. That's when your body is in crisis. Then your body knows you've got a couple options. You can run away from the danger, you can stay and fight. But either way, it needs to prepare. It either needs to get that blood going to the legs to run away, or that blood going to the arms to start fighting. Doesn't need it in the head, okay? So it sends all your body prioritizes, and it says, we don't need to do algebra right now. Okay? We need to get ready. So there are things you can do to slow down your body, because your body's just racing. It's that adrenaline.
All the time. All the time. It doesn't matter where I'm at.
It's why you hear these ladies who the little kid is under a car and they pick up the car.
Oh, gosh,
That's
yes.
adrenaline, right?
Okay.
So, and that works, but being on that level for too long, for a year, is hard on your body. You don't get your sleep. Sleep is how your body heals, okay? So there's a couple things you can do, and I'm going to teach you one because it's the easiest. But I'm going to tell you something.
Okay.
When someone is upset, and they're really upset, you have children, right?
Mm-hmm.
Did they have little temper tantrums when they were little?
All the time.
Yep.
My husband has temper tantrums. Some
of us grow out of it, some of us don't. If you have a little child having a temper tantrum, and you look at that child and you say, now what's wrong with you? Why are you doing that? Are they going to be able to tell you?
No.
No. If you're in this panic, that's not the time to try to, you kind of have to ride it through. But if you feel it coming on, your body gives your signals. I know with myself, if I'm getting upset, my stomach gets in knots and my face turns red. Do you have signals that you know when you're getting upset?
I do. Definitely feeling that tightness. I feel clammy. I feel sweaty and cold. I get very nervous, and I don't feel hungry. I feel nauseous. I want to throw up. And
if you think about it, it's probably during those times that you're breathing differently. You're probably breathing kind of fast, so that oxygen doesn't get into all the nooks and crannies. So one of the easiest things to do when you start to get anxious is to slow down your breathing, because that slows down your body. It slows down your brain. And the easiest way to do that is you count to 5. You can count to 5, right?
Yeah.
But put the Mississippis in. Don't go 1, 2, 3, 4, 5. Doesn't work. You have to do 1, 2. So what you do is you inhale as you slowly count to 5, and then you hold that breath as you slowly count to 5, and then you exhale as you slowly count to 5. Get it all out. Would you like to try that with me once?
Sure, let's try it.
Okay, I'm going to count to 5. And while I do it, just take a big inhale, get as much air as you can. And then you're going to hold it while I count to 5. And then you're going to let it all slowly out. Okay?
Okay.
Okay, so let's do the inhale. Ready? 1, 2, 3, 4, 5. Now just let the oxygen stay. 2, 3, 4, 5. Now let's exhale. 1, 2, 3, 4, 5. How did that feel?
Oh, great. So relaxed already.
You slow down. And when you're doing it and you're counting to 5, you know what happens?
What's that?
Your brain is focusing on 1, 2, 3, 4, 5. It's not focusing on what you heard in the news or whatever.
True. All I could think about was the breathing.
Yeah. And then that oxygen gets there. Okay. So there are other things. Another thing that you can do is if you have all these feelings that are kind of caught in and your thoughts race, you need to let them out. And if you don't have someone who can hear them, you get a lovely notebook. You know, they have those really pretty journals and the fancy pens with the different colors. Make yourself a journal. Now, if you get the thoughts out and they're scary thoughts, you know what the wonderful thing about a journal is? The pages come out. You can rip them up, you can throw them away, you can do anything like that. Okay? And that'll help let some of these feelings out. So if you want, what we can do is we can schedule another time to meet, and in that time we'll do a physical, we'll get some blood work, we'll talk about what's going on, and you can tell me how your week went. How does that sound?
That sounds wonderful. I'm so glad I found you.
Oh, I am too. You're going to be wonderful to work with.
Thank you.
So
So I feel so good about this already.
good. So let's make this plan, but you need to make me a promise, okay?
Okay.
If between now and when we meet again, you do get a thought of hurting yourself or hurting someone else, I want you to call 911, we have the emergency number at our office, or go to the hospital, okay? That's just the big deal thing that you need to do. But other than that, try the breathing, try the journal, and have a good week.
Okay.
Okay? Thank you.
That was wonderful.
Oh, dear Lord. I don't think I interrupted you.
Great. That was beautiful.
Oh, thank you. I turn into a New Jersey person when I do therapy. I don't know why. I'm from that area. Down here, I tend to pick up the South Carolina accent, but for some reason, when I do therapy, I turn into a New Jersey person.
I loved it, though. It was great.
You were good.
Oh, it was great. I totally forgot that suicidal ideation. My patient's probably going to go home and hang themselves.
No. That they're not really. I mean, she just said she felt like she can't go on, but you threw that in there. So I was like, thank you. You threw me a bone.
Well, it's important though. You should always, and that's the nice thing about having the prompts at work, because you always know. And then I was thinking too, we didn't even assess the tobacco or nicotine or alcohol or drug. I mean, not that she's 72 and she's scared about opioids, but you never know.
You never know. She could be token up back there, The only thing that helps me is when I take heroin myself.
Right. Right.
Okay. Well, I promise you I will save this one this time. I am so sorry about that.
Okay.
And I'll send you a copy of it.
Okay.
I don't think we have any workbook stuff, but if I finally have everything, but if you need something, that you haven't gotten from the materials, let me know, because I can take pictures and send them to you.
Okay. Well, thank you. I appreciate it. Yeah, I'm gonna look through here the rest of tonight and see what I need to get a little more organized, and we'll get caught up.
I'm telling you. Okay. Well, thank you so much. I love working with you.
I do too. You're awesome.
Oh,
I have such a fun time.
You too. I could spend all night talking to you, but
Same here. It's
you gotta
great.
have your life.
It's a nice way. I have to tell you, I had a really bad day. It was about,
Oh.
I don't even know how many patients. I had 5 psych evals. Like it was just
Oh.
after driving and doing all that. So I really appreciate like laughing and seeing you and chatting with you. It's a nice ending to a good day.
It is. Okay, so we're okay for next Tuesday, 6:30?
Yep. Every Tuesday till the cows come home.
Okay. Okay, darling, you have a good week.
You too. Have a good night.
Thank
Bye.
you. Thanks. Bye-bye. Yes. Okay. Now, I gotta do. How do I go back?